नमस्कार। डेटॉल एनडीटीवी बनेगा स्वस्थ इंडिया के लॉन्च के इस कार्यक्रम में आप सबका बहुत बहुत स्वागत। मैं अमिताभ बच्चन। देखिए, 5 साल पहले मैं एक अभियान लेकर आपके बीच आया था, स्वच्छ भारत का अभियान। आज मैं इस मुहिम को कुछ और आगे ले जाने के लिए आपके पास आया हूं। स्वच्छ इंडिया तब तक पूरा नहीं होगा जब तक वो स्वस्थ इंडिया में न परिवर्तित हो या बदले। हमें एक ऐसा देश बनाना है जहां बच्चे सेहतमंद हों, जहां बच्चों का जन्म अंदेशे से ना भरा रहता हो। क्या आपको पता है कि अभी जो 40 बच्चे जन्म लेते हैं उनमें से एक की मौत जन्म के पहले ही हो जाती है, और 5 साल से कम हर 25 बच्चों में एक को हम बचा नहीं पाते। ये सूरत बदलनी चाहिए। हमें स्वस्थ बच्चे चाहिए, हमें स्वस्थ माताएं चाहिए। अगर इन्हें सही पोषण मिले, सही देखभाल मिले, तो भविष्य की बुनियाद बहुत मजबूत हो। तो आइए हम सब मिलकर ऐसे ही समाज को बनाने का एक छोटा सा कदम उठाएं। बहुत बहुत धन्यवाद आपका। नमस्कार।
Thank you very, very much for
Thank you so much for
sparing the
once again
time
we come
again.
together. Thank you so much. We're together again.
He's really the motivating factor behind all of us, and we are,
As always, yes.
as always.
In the last 5 years, what has happened is that we have defeated the cynicism of this country. That's
And I tell you something, it's so important what we're doing now is moving from 5 years of Swachh cleanliness to why it's important for hygiene. Because, for example, at the time of birth, when a mother has a child, that's the biggest danger to her life and to the baby's life, because there's not enough cleanliness.
Yeah.
Just that one moment, if we are clean at that time, you can save 10 million babies.
Wow.
It's huge, and we are way behind on world statistics, but we'll catch up because we're moving from Swachh to Swasth.
Yeah.
In the last 5 years, we've been emphasizing on how it's important to keep our surroundings clean, have access to toilets to make India open defecation free, and follow a very strict hygiene plan. This has naturally led to Swasth from Swachhata. We can talk about health endlessly, but the foundation to everything, the key foundation to health will be cleanliness and hygiene practices, won't it?
Yes. If you do not wash your hands while ingesting food, along with food you are also ingesting a lot of bacteria like typhoid, cholera and many other pathogenic and non-pathogenic.
At childbirth, there's the biggest danger to the life of the mother and the child. That's the time when they can most susceptible to either fall ill or even die. And that can be checked by simple methods. Wash your hands, keep clean water. How do we get people aware of this? No, go ahead, ma'am.
This 1000 days windows are very important. That is conception to 2 years of life, nutrition and hygiene. The baby that is born is more likely to face frequent infections and is more likely to perform poorly in school because of cognitive impairment and also poor memory.
We were trying to do this, spread awareness for, say, the first 28 days. Is it a huge expense that has to be incurred, technology, incubators, or just simple practices which don't cost much?
We have clean water, we have hygienic practices, we have safe toilets in our health facilities. So a combination of these would definitely show results.
Manisha ji, I would like to come here and ask you, what impact you see in urban Maharashtra with the Swachh Bharat mission when we're looking at the health impact? What really do we see on ground?
I completely endorse this transition from Swachh to Swasth, because on ground this is exactly what we are seeing.
Do emissions have a similar problem as far as health is concerned? I'm sure it does.
Absolutely, it has. And therefore, Maharashtra has planned in a very big way in the next 5 years or 10 years for people to move from private cars to public transport.
Amazingly popular programs. You do always highlight the importance of cleanliness for health. It's not just about great taste, which is important, but health as well, right?
Taste without hygiene, it's never. Especially in India, we have always known this. Place of a kitchen is only next to a temple in a household. We actually, most households in India you would never enter a kitchen with your footwear. right? Somewhere down the line we have lost those things. I think we need to come back to what we have learned, and this is something I'm sure with initiatives like this we would always find some traction, and we can see.
There's a small little institute in Gujarat which I've visited, and which is addressing this problem. So it's a very simple, innovative idea. The kitchen, or where they cook, they put, where the smoke comes out, they made a little cubicle or barrel. So the smoke goes in that, and that barrel goes either up in the air, so they are not polluted, but in many cases, because that tube becomes hot, they wrap and bring water to it to create hot water.
Wow, wow.
I mean, it's really innovative. It's a lovely little institute in Gujarat, where they're using the smoke that's coming out
To heat water
to
as
heat
well.
water, and also to keep the person pollution free. Yeah.
We have a message from Mr. Raghubir Das, the Chief Minister of Jharkhand, where they've done quite a bit of work in the last year to reduce some of the incidences of communicable diseases and have raised the hygienic standards.
मुझे एनडीटीवी परिवार को बहुत बहुत साधुवाद धन्यवाद देना चाहता हूं कि जो लगातार स्वच्छता पर देश को जागरूकता करने का काम कर रहे हैं, और इसी तरह हमारा भारत का आन बान शान अमिताभ जी भी लगातार स्वच्छता के माध्यम से, चाहे वो एनडीटीवी के माध्यम से हो या अन्य माध्यम से, लगातार लोगों को जागरूकता करने का काम कर रहे हैं। और परिणाम स्वरूप 2014 के पहले भारत और आज 2019 के भारत में स्वच्छता के संदर्भ में काफ़ी बदलाव आए हैं। अभी और काफ़ी करने की ज़रूरत है। नीति आयोग ने भी झारखंड में स्वास्थ्य के क्षेत्र में तेजी से सुधार करने वाले राज्य की गिनती में आया है।
छत्तीसगढ़ में 37.6% 5 वर्ष के जो बच्चे हैं वो कुपोषित हैं। 41.5% महिलाएं एनीमिया से पीड़ित हैं। तो क्या ऐसे कुपोषित बच्चे और महिलाओं से आप स्वच्छता की उम्मीद कर सकते हैं? और इसलिए सबसे पहले कुपोषण की लड़ाई छत्तीसगढ़ सरकार लड़ रही है। यदि आपके घर साफ नहीं होगा या गांव साफ नहीं होगा, मोहल्ला साफ नहीं होगा, तो फिर स्वास्थ्य पे विपरीत प्रभाव पड़ेगा। दोनों एक दूसरे से जुड़े हुए हैं।
बिहार सरकार ने जल जीवन हरियाली नाम से एक मिशन मोड में कार्यक्रम प्रारंभ करने का निर्णय लिया है और 2 अक्टूबर से इसकी औपचारिक लॉन्चिंग की जाएगी।
क्या कंपोनेंट्स क्या हैं?
देखिए, इसमें मुख्य कंपोनेंट तो ये कि बिहार के अंदर जितनी वाटर बॉडीज हैं, हम लोगों ने सैटेलाइट के द्वारा सर्वे कराया है। फिजिकली भी जाकर एक एक वाटर बॉडी, छोटा हो या बड़ा हो, तालाब हो, पोखर हो, गड्ढा हो, उसके सर्वेक्षण का काम चल रहा है। दूसरा काम ये होगा कि जितनी वाटर बॉडीज हैं उसमें बड़े पैमाने पर इंक्रोचमेंट है, उनको हम अतिक्रमण से मुक्त करेंगे। और तीसरा कि बरसात के बाद उसकी उड़ाही करना, चाहे मनरेगा के माध्यम से हो या अन्य स्कीम के माध्यम से। जितने भी हमारे तालाब हैं, अगले 3 साल में एक भी तालाब ऐसा नहीं बचेगा जो कि अतिक्रमण मुक्त नहीं है, और जिसको उड़ाही कर डिगिंग करके उसको और गहरा किया जाएगा और उसमें पानी भरने की व्यवस्था की जाएगी, चाहे वो जल वर्षा का जल हो या कोई अन्य माध्यम से। उस प्रकार से और भी जिन नदियों के अंदर पानी ज़्यादा है उसका हम ड्रिंकिंग में कैसे इस्तेमाल कर सकते हैं। तभी नालंदा, नवादा और गया जिला जो कि वाटर स्ट्रेस डिस्ट्रिक्ट्स हैं, जहाँ 12 महीना पानी पेयजल की कमी रहती है, तो गंगा नदी के पानी को पाइप से उन तीनों जिलों के अंदर पहुंचाकर और पेयजल की व्यवस्था करना। फिर जितने सरकारी बिल्डिंग, स्कूल और हॉस्पिटल्स और सरकारी बिल्डिंग अन्य है, रेन वाटर हार्वेस्टिंग की हम लोगों ने व्यवस्था करने जा रहे हैं और ये भी काम जो है हम लोगों ने प्रारंभ कर दिया।
Mr. Khan, thank you for joining us. Can you tell us the health index report which has been developed by the Niti Aayog?
Well, we strongly believe that it's not possible for India to grow at high rates of 8 to 9% over a 3-decade period without a huge focus on health and nutrition. Our view is that a lot of work needs to be done on health, and it's not the shortage of resources, it's not the shortage of food. There are several governance issues, and we believe that if you start ranking states, if you start putting it in public domain, if people get to know that good administration is good politics, then things will start changing. And what we've done in ranking states is that we've not gone by historical factors that Kerala will always be number one, but how has been the incremental change during the course of the year. And while historically Kerala, Andhra, Tamil Nadu have done well, what we find is that incrementally Rajasthan, Haryana, Jharkhand have done some path-breaking work, and they have moved up the ladder.
We're now joined by Dr. Harshvardhan, our Health Minister. Sir, in the last 5 years, we've all been talking about Swachh India, Clean India, and now we're talking about Swasth India and a Healthy India. Do you think these conversations have created a conversation around the country over health, hygiene and sanitation?
Oh yes, significantly. I think there has been a sea change in the attitude of the people, and I think whatever the government has been able to do from its side, putting up over 10 crore toilets in the whole country and having more than 5,60,000 villages having become open defecation free. Very soon we will be able to declare that the whole country has become open defecation free, and there is so much of thrust and so much of public awareness around these sanitation and hygiene issues. The sanitation coverage has gone up from 35% to almost over 97-98% in the whole country.
We have, as you know, we have been working on tuberculosis and hepatitis B, but we need a lot of government support in these two ventures, Dr. Saab. You know, I keep quoting my personal example all the time and try and propagate the idea of getting yourself detected. And I don't mind saying it publicly. You know, I'm a tuberculosis survivor.
Right.
I'm a hepatitis B survivor. A bad blood infusion went in and 75% of my liver is gone. But because I was able to detect it, even after a period of 20 years, when 75% of my liver is gone, I'm still surviving on 25%. And this is what I'm able to propagate, that get yourself tested, get yourself diagnosed, and then there is a cure, even with tuberculosis. I didn't know for almost 8 years that I was suffering from tuberculosis. And I keep saying it with a lot of immodesty, if it can happen to me, it can happen to anyone. And therefore, if you are not willing to get yourself tested, you'll never find out, and there's never going to be a cure for it. So can we have some kind of government support in pushing these awareness campaigns, where we know treatment is there, but to push the individual to go and get himself tested, diagnosed, so that the ailment can be found out?
The program that we have launched, the Ayushman program, has one component, which is the creation of the health and wellness centers all over the country. And we have a plan to create 1.5 lakh health and wellness centers by the end of 2022. We have already created 20,000. By March of 2020, we will be creating another 20,000, and so on and so forth. And at all these centers, our basic aim, and I think the strength that we are going to create and we are in the process of creating, is around prevention and promotive health, so that we can diagnose all these diseases early. I am sure that with people like you around us, who are also willing to spearhead this movement in a big way, we shall certainly be able to handle them appropriately and show significant positive results to the country. We are equally, the government and our Prime Minister Narendra Modi ji, is very, very passionate about health issues.
Mr. Iyer, this is Amitabh, and needless to say, we've been working together in the many campaigns that the Honorable Prime Minister has initiated along with you, and you've been a great help, a great source of pushing us every day. I hope that it will also reflect in our new campaign, which is called the Swasth Bharat campaign. I'm pretty sure that it will be successfully as well.
Swachh and Swasth go very closely together, and in fact, as you mentioned, Pranoy, the best medicine, in fact, for preventing childhood diarrhea and stunting is actually the use of a toilet. We need to keep the work going. We need to sustain the ODF outcomes and move on to ODF Plus, which includes definitely working with the Women and Child Department, focusing on nutrition. All this needs to come together to give us the best health impacts.
We would like to welcome Ravi Bhatnagar from Reckitt Benckiser, and we also have
He's
with
the
us...
motivating force behind all this. Amazing hard work. You're leading the whole thing.
Yes.
Has been a good experience?
Yeah, it's basically like, how we look into the whole program is, the first component is on the breastfeeding. We need to strengthen the breastfeeding because the breastfeeding rates really needs to be, we have to do something on that. There needs to be a conducive environment for the women so that they can, there are a lot of migrant women in these two districts where we work. So creating the breastfeeding pods for them, creating an environment so that, women can actually do it, and also thinking about like, there are some women who can actually, who can't breastfeed. Talking to, those like, what's the problem? So there's some, the indigenous knowledge what they have. They say like when you eat the millets or when you eat some other local crops, you produce more milk, you can lactate, as well as many needs the medical intervention also. But largely it's a socio-medical intervention on which we are working on, and ethnography was the first thing. Like, in today's India, we are talking about like there is the Anganwadi worker and the community, they are not able to speak one language. The doctors in the primary health center and the tribal population, one is talking in the Bagri or Bhil or some dialect, and the doctors who come from the urban places, there is a total mismatch, and when they can't understand what's the problem. Next thing what we are seeing is the use of technology. The standardization of technology, like first 28 days of the child's life is very important. That's the time when hypothermia happens to the kids. The temperature suddenly falls. We thought like, can we do something on that? And we introduced that in the basic healthcare kit for the moms. If a kid's temperature is going down, a machine gives a signal to the moms in terms of a beep, and the mom brings child near to the chest as a kangaroo care, and that will lead to the better life of the child, and the hypothermia can be taken care of. Just few things.
One quick thing that I wanted to add here was, see, we've called this entire program VSTF, Village Social Transformation Foundation. This social change takes a lot of time, but when leaders like this come with us, we understand Ravi is somebody who can lead this entire change through technology, through huge back-end educational support. We've made some tremendous advances as far as tools are concerned, and that is what is making the impact.
Mr. Bhushan, thank you so much for joining us.
I just want to know, you said 70% of the private hospitals is 70% and 30% in rural areas. So I'm assuming that most of the talented doctors go to the private sector and the public sector doesn't get the talent. What do we do about that?
Well, Mr. Bachchan, I think it's slightly more complex, because if you look at the quality of services, I would still rate AIIMS or many of the tertiary care public sector hospitals as one of the best, which has biggest or best talent or skills available. But you're right, on an average, most of the qualified or talented doctors and physicians would like to be in big cities and in private sector, because that's where the paying capacity is. But we need to understand that this scheme Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is changing that equation.
What are your thoughts about nutrition when we really look at it as a country?
Well, as people have said, the first 1,000 days is where you intervene and you make a difference. Nutrition, apart from hygiene, is one of the biggest problems that India faces today. If you have wasted, malnourished children who don't live the potential, that obviously hampers their lives, poverty, and also this country. So getting the right food, getting local food, which people don't know about, education is extremely important. There's stuff that we have learned in ethnography study in this area, faith-based healers. People go to faith-based healers who do their own stuff and nothing happens. So we are actually getting faith-based healers to refer people to hospitals, and we are actually helping them out. So we are saying, okay, if you refer people to hospitals, we will pay you 300 rupees. We are paying people, when somebody said today that when you fall sick, you lose your wages, your whole family. So we are paying people who are going to these public health service centers daily loss of wage, so that they are motivated to send their family member or the mother to go and put the child there and stay with the child when he or she is born. So there are many other things that are involved apart from just pure good food.
So what, Gaurav, I just ask fundamental question, motivated you into getting into this area? Because it's wonderful, and I hope all other corporates follow this example of, and you're the force behind all of this. So what motivated you into this?
No, Dr. Roy, I mean, our focus, one is stems from our vision, which our CEO had said, which is of health and hygiene and how healthy lives and better homes. So that is our motivating force, but the kind of success we have seen in the last 5 years with the Swachh program, the kind of this country coming together and working together, it's a natural progression for us to move towards better. It's not that we will stop our hygiene programs, our school program will continue, our forestation program will continue, our diarrhea program will continue, all that will continue. But to make a direct impact on real impact on lives of people in these first 1,000 days is now. So breastfeeding, malnutrition, neonatal problems, all of that is where we are moving towards, and it's very natural.
This year's health campaign, it's the Swasth Box.
Box that we are going to give as part of the campaign and raise. Viewers can send in donations, and mothers will get this, and it will really help them.
So I just want to quickly tell everybody what's in this box. So there's hand sanitizer, there's a bar of soap.
की सामग्री है इसके अंदर.
There's soap.
साबुन है.
There's Dettol wipes.
Dettol भी है इसके अंदर.
There's sanitary pads.
Sanitary pad भी है.
Baby blanket.
बच्चों के लिए तो कंबल हैं.
Yeah, there's mosquito net, you know, to prevent vector-borne diseases.
Yeah.
From mosquitoes.
मच्छरदानी भी है इसमें. जहाँ लोग
And then there's nail cutters. There's
नाखून
zinc.
काटने के लिए.
And then there's small sustainable toy for kids, like a little toy.
छोटे-छोटे खिलौने भी हैं उसके अंदर.
Then there's literature on breastfeeding, how to, why it's important, all of that. That's also in both languages. There's literature on hand washing, very crucial. That's also in both languages. And then there's the hypothermia alert device.
Amitabh, we've already raised funds for this, and we're looking for more and more. And on October the 2nd, we'll get. So we could have thousands and thousands and thousands of these, depending on.
What is the price of this?
This is 4,700.
4,700.
Yes.
And
actually, this is not for
we'll be donating it, sir.
It's
I just want
so
to.
I want to make a donation of 100 such boxes.
Thank you so
Wow.
much.
Wow.
We did that
So
for the scavengers.
whatever we get through this whole campaign, RB will donate exactly the same amount.
Wow.
On the whole
That's
campaign.
amazing.
We'll match that.
Amazing.
And also, I just want to say that.
100 और कर लीजिए सर.
Yeah.
जी?
Oh.
100 एक और कर लीजिए.
Oh,
wonderful,
thank you.
wonderful.
Okay, everybody, thank you all very much, particularly you youngsters at the back there. Thank you very much. We're moving from Swachh to Swasth to make India a healthier place.
We'll be back with the big.
Yes,
show.
on the 2nd of October, we're going to be back with the big telethon, where we're going to be here throughout the day talking about Swasth India and thanking NDTV and the entire crew for it. Thank you.
Thank you, thank you.
जर्म्स तेरे हाथ धो के पीछे पड़े हाथ धोले पहले भाई बाद में ले खाना बड़े मानवेली घर में खर्चा कम क्यों करता कचरा सड़ता जाता गंदगी भी बढ़ती जाती 10 बीमारी तेरे पीछे लगी बच बीमारी से नन्हे बच्चों को भी रख बीमारी से दूर स्वच्छ बनेगा तभी तो स्वस्थ बनेगा हाँ ये शॉट है भाई स्वच्छ बनेगा तभी तो स्वस्थ बनेगा तभी